Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Mm-hmm.
Well, Dr. Mencia, welcome.
Welcome back.
Welcome into the world of women here.
Yeah.
I love it. Well, Dr. Mencia brings a lot of interesting people. I never know in the morning until he comes who's going to come, but they're all beautiful and friendly. He demands it. He brings a whip with him.
Yes.
You know.
Yes.
Okay. Let's do it.
Let's get to work. Well, since I know that what I hear from your listeners, that sometimes they set the clock at 7 o'clock. So they can listen to you and I at 7 o'clock. So those ones that miss the first half hour,
they can get it on YouTube.
They can get it on YouTube, but let's reintroduce our guests again.
Okay, why don't you do that?
Oh, yeah, we have
You love
Suzanne.
them so much.
I love them. We hug each other every morning.
I know.
We love them too.
We love them too. We all,
Definitely.
it's filled with love. It's true.
Yeah.
So Suzanne is the senior hygienist at the center. She has over 25 years of experience as a hygienist. Doreen is an executive dental manager, so she supervises and report directly to me with regard to both the Boynton office and the Fort Lauderdale office. And Michelle that also work at both offices, but she handles mainly the Boynton office, and she does a lot of the planning.
The education.
And the education. She loves to educate, and I see them. They are very genuine in their work, and I've been blessed. I've been blessed by God by giving me people that make me feel so comfortable, with fulfilling my dream of providing a good medical dental center with all of the specialists that we need to take care of our teeth and then also to the rest of our body.
And so tell me, as a testimonial, what some of your patients say as far as your dental department. I know you've had a lot of compliments, but why don't you tell me maybe someone who was unusual, or you did share last time that...
Yeah. Well, I remember some 9 years ago, maybe a little bit more, we had a family that called us from the Keys. And they had a 14-year-old daughter that had a phobia for dental from a very young age. And they didn't know what to do. So they just buy her mouthwash and the electric toothbrush or whatever, but it was really bad. And she needed a lot of work. So we brought her in, and we brought her to the medical department. So she was okay by seeing a medical doctor. And we gave her a little oral sedation, and we explained to her, we want to look into your mouth, but we want you to be comfortable. So she thinks, that the medical department is going to look into my mouth.
Right.
So I'm okay with that.
I love this.
So we gave her some mild sedation. We brought her to the dental chair then. We put her completely to sleep, full sedation, so it was more of a pleasant experience. By the time she woke up, all of her dental work was done. Completely. And she woke up in the dental department. And we are all there supporting her, holding her hand, and smiling at her. And this young girl taught us so much, because when she woke up, she said to us, I have never seen people working in my mouth, and I never expected people working in my mouth and smile at me and be so friendly like you guys are. And she still come to us as a patient.
See, now that is a wonderful story.
Because, sometimes the dental department can be a very cold atmosphere. And we do every morning, Doreen and Michelle can tell you, we do a huddle, where we all sit down and we tackle, okay, what is coming today? Who is coming? Why that person is coming? Did we call the lab? Are if we're doing an implant? Do we have the equipment ready? Do we have do we order the pieces that we need for that patient, etc.? So it's a lot of behind-the-scene coordination that make the dentist look good. And they all know that. When we sit down with the team, I let them know this is like a football team. You cannot say, okay, the one on the left side, you can just go and sit down. We're going to play okay. No, you need everybody on the team to really win the game. So, and like we say in the first half hour, I strive for reminding the whole staff that time is precious. I don't care if you are 19 or you are 99. Time is precious. You have things to do. You want to go and get your hair done, or you want to go and have coffee with your friend, or whatever you want to do. You want to go and have sex after, having your...
See, what is that? We've been taking this, making this very clean. We just jump right into that, huh?
Yeah, that's right. What? I knew that one too. It wakes up our listeners. That's what do. They wait for it. You didn't talk about sex this morning. But that's true. But your point is well taken. Everyone thinks that maybe they don't. I don't really talk to dentists and ask them, well, do you not care if this person, well, he's 90, he has all the time, he doesn't go anywhere. But your idea is really right, Dr. Mencia. So, Michelle, I guess you can add to that.
Yeah, we do care. We do care for our patients, for each and every patient, and we value each patient's time. So that's why we try to have a great communication with the team as well with the patient. And, we always try to have that communication and the bonding and try to help the patient out.
Well, tell me about this. You have couples who come in, and how do you work that? Do they sit there together, or do you just wait? One does, one's in there, and then the next one comes in, or you don't have double chairs, I don't think. Do you like massage therapists, right?
No. Usually, I do have couples that do come in together. There are some couples that like to waiting outside. Some wives don't want their husbands looking at what they're getting done in their teeth. But, we work with everyone, and we think.
Go ahead. And sometimes they keep secret from each other.
Oh.
You know that?
Oh, yes,
they keep secret. I don't want him to see the.
Oh, you're kidding?
Yes, they do. Yes, they do.
What kind of secrets? Oh, this is how they keep secrets, right?
Yes, they do.
Oh, I don't want him to see that other tooth that's not working. Oh,
yes.
I would think, wait a minute.
He doesn't know
the false
he doesn't know I have a partial.
I was just going to say, especially if they're just dating or something and they're not married.
And I remember in the medical side, I tell you a little gossip. In the medical side, I have husband and wife, and the husband is sitting in the corner in the chair, and the wife, and then she kept signaling me to cover so that he doesn't see. And I'm a little bit concerned, what she want to do. I don't want somebody accusing me or something.
Oh, this is
so funny. I move and I cover the husband, and then she took out her teeth, and I say, I need to go to the dental department to get it. I say, oh, okay. Well, I'm going to send you guys. I'm going to send you guys up there to the dental department. I want them to just take a look at your wife, because when I look at her mouth, I wanted to take a, and they go, okay.
Let's get back to this other part. There are people now.
You like that?
Yes, but wait, but they're dating, and they don't know. Older couples, they don't know that one maybe has false teeth, or we call them
right.
What is called?
There's a lot of patients out there that the spouse doesn't know that they have dentures, they have partials, and they keep it well hidden. But
I wonder how they can do that.
But what they have to do, is that nowadays we can do those snap-on.
Yes.
So we can do those special implants, and you don't have to be putting glue in your teeth and all of that. So dentistry had advanced a lot.
And when the lights turn off, the teeth come out.
And there's a implant. There's patients that are missing all their teeth. So let's say they do the upper implants on the top. There's two different types of dentures. There's the over dentures, and then there is a hybrid denture. This hybrid denture stays in the patient's mouth permanently they come at once a year. They get unscrewed, and we clean them up for them, the dentures and everything. Yeah. And well, they had to come into the office once a year. We unscrew the implant parts and remove the dentures. We clean them up for them and make them nice, and then we put them back, and the patient just comes once a year. And these dentures stay in their mouth for a year. They don't have to remove them at all. And this is a hybrid denture with the implants.
So, Dr. Mencia, you've been keeping Michelle hidden here.
I know,
She really knows a lot of stuff. What's happened? That's what I guess this morning.
I've been talking to the executive manager, Doreen, about, doing the show. And I wanted them to come for a long time. And, when I saw Suzanne working yesterday, and she's so devoted to her patient. I mean, she spent time with you, and she takes care of you, and she talks to you, and she gets to know you beside your teeth. She gets to know you as a human being. And I say, Doreen, let's bring dental in. Let's bring Suzanne. Let's get the hygienist in there. Let's talk about hygiene and the importance of this thing. Because, the hygienist is the pedestal of prevention. When it comes to dental care, there is no ifs, ands, or buts. If you're going to take away all my dentists and you limit the hygienist, we still can do good preventive medicine.
Yeah, well, because, it's obvious after listening to you that, you're doing a lot more than just using your utensils. You're observing things, you're figuring out what can happen. And I think the other thing that goes on with people is that, and I think Dr. Mencia said this, with the cavities, that if you see something, they didn't come in because they had a cavity, right? They came in for something else, and now you notice a cavity, and if it's not taken care of, then Dr. Mencia said they could be heart problems and other kinds of things, right?
Yes. Many times, whether it's a recall patient or someone that's maybe is our patient, but it's been like maybe a couple of years. They just got busy and kind of forgot to get back into the office. And they may come in and go, I feel great. I take the x-rays, I remove the calculus, and sometimes there's a cavity under there, which I say to the patient at that moment, have you felt any sensitivity here? And it may be on and off, and they forget, but then they'll go, you know what, yes, I have. I go, well, there is a cavity here. I'm going to have the doctor come and check this for you.
Right.
So I find things, or when when they're coming in for their recall, if there's treatment to be done, sometimes they may forget, oh, yes, there's another filling to be done, or something, and I always kind of bring it up comfortably so that they'll tell me I can do it. I want to do this now, or I'm not ready yet. Maybe the next time when I come in 3 months, I'd like to discuss it again, and then maybe make an appointment.
So,
we're
Suzanne,
talking about it.
Do you like the dentists that you work with?
I love them. I love the assistants. I love everybody, and I love my patients.
But you have to like the dentist, don't you? Because if not, you don't have confidence in the dentist.
No.
But Dr. Mencia has been very good about having great dentists.
They're all great.
Yeah, and they are all very honest to me. They will let me know if there is a dentist that they feel is not part of the team, is not following our dream. We get rid of that person and bring somebody else. We have, thank God, we have a great team of dentists. We have a great team of assistants. And we are like a family. I tell them, I go in the office 6 o'clock in the morning, 6:30, and sometimes I don't leave until 7, 7:30, 8 o'clock. So I say, this is home for us.
Well, it's a Saturday.
We spend more
he's the
time
first
here.
Doctor that I know of that even has Saturday office hours.
Yes,
and
there's
then
not
to have
many.
a dentist on Saturday, forget it. If something happens to you at 5 o'clock, they're gone on Friday, right? And you don't come back until Monday.
They've come to see a patient. They've come to see a patient on a Saturday night. Or they've come to see our dentists have come to see a patient on a Sunday.
Yes.
We've opened up the office. If they're in pain, they open up the office. We've even gone to pick up the patients. We go that extra mile.
Yes.
Right.
Yes.
We go that extra mile.
Sometimes the emergency department, they know about AGI, so they will say, call this office, call this number, and sometimes somebody's going on a cruise and they have a dental emergency, we'll go in.
I remember you had a whole story about that woman going on a cruise, remember?
We go in, we open the office, we bring one of the dentists, one of the assistants, myself, and we take a look at the patient. Sometimes it's just me and one of the assistants, and we go there, and if it's like an abscess, something like that, I might take a picture, send it to one of my dentists that can review the picture, put the patient on antibiotics, send them on their way. When they come back, we take care of the problem. So basically, the emergency is 7 days.
Yeah, it's everyone's listening to the show, and I think they know, if you've been to Dr. Mencia's office, that this is true. This isn't, if you've just started listening, you say, oh, that's not possible. Yes, it is possible. You don't know this, Dr. Mencia, but in the magazine, the August issue will be coming out this coming week, and there was an article I saw that I used, and then I added a paragraph with your name on it. I was going to surprise you, but I just tell you. It's called Doctor's Visits at Home. It was a national article, and why, is that starting to happen? And so I put a little in there, and then at the next paragraph I said about not only does Dr. Mencia, and Dr. Andy Mencia does this here in South Florida, he also has dental people coming to home visits, which is unheard of.
Yeah.
Yes, we have.
And so, that's a very important point. Now, I don't think they have dental hygienists, because that's a whole equipment.
No, but I've been
kind
asked
of a thing.
by some patients.
Well,
when I come to their house,
no, you can't do that because they're not equipped. But
yes,
at least
we're not equipped.
But at least they are doing other kinds of things. I think the worst thing that I remember my mother had a problem is she had dentures. But as you age, the dentures get loose and all. I mean, nobody does anything. So now they can't eat, and now there's a big problem. So it's Dr. Mencia, you really did do something very valuable in your home visits.
With the home visit, and I'm both departments working together, and we have attempted to do a few emergencies. Jason, one of the nurse practitioners, he's so thorough, and he go and he look at the patient's mouth, and he pick up things that most nurse practitioners will not pick up, because some of those patients are demented. They won't be able to pinpoint exactly what's bothering them. But the family members that know the patient, they say something is wrong with daddy, something is wrong with mom. This is not her. And then we start examining, it's not a urinary tract infection, it's not like she has a sore in her butt. And we kept looking the mom and say, oh my God, this is the problem. We accommodate to bring the patient. Some of the patients, they had to come in by stretcher. But we have a huge operatory there where we can do all kind of surgery. And they come in by stretcher, we transfer to the operating table, we do our procedure, and send the patient home, and then communicate with the family to make sure everything is okay post-operation.
Yeah, you bring up a good point. There's so much now, not only Alzheimer's, but dementia, and really, it's serious, and they don't really know how to tell you anything. And,
exactly.
And I was going to ask you, how do you know? If, let's say, no one comes with them. I mean, how do you know? By
being a good clinician. You have to be a good clinician. You have to be able to look for what's there. Being a geriatrician is like being a pediatrician. The patient can be impacted, the little baby, but he won't say, my belly hurt.
Good
so point. you have to be a good clinician to say what's going on with the patient.
Yeah, especially so if they have something like that. Well, this has been a very interesting conversation, because most people don't get a chance to do this. They don't know what goes behind in the doors. The doors close, and you're just sitting in a chair, and who knows. But now you've really, I think, opened up what should happen. Doesn't mean it happens at all the dental offices, but this is I think a model case of what you should expect. And if you are going somewhere else and you are not getting the proper treatment, go for a second opinion. Go to Dr. Mencia and the AGI, and let me give that phone number again. The phone number in Palm Beach County is 954-489-1345. 954. Remember, this is Pencil Talk Radio.
Fort Lauderdale.
Yeah, this is Fort Lauderdale. 954-489-1345. Now, is your dental office open today in Boynton Beach?
The Boynton Dental, no, the Fort Lauderdale is open today.
That's right, Saturday. During the week,
the Boynton office is the dietitian, I believe, might be. Oh no, she's off today. So
okay,
no, it's closed.
But if you have an emergency in Boynton Beach and you call the number, we are definitely there. And Dr. Rosemary has come to the office and opened up Boynton Beach to see emergency
It's
patients.
amazing that you take this so seriously.
And what's your direct line, Doreen, if they want to call directly?
Our direct line is 954-489-2517.
That's a good number because then you don't have to go through the
Boynton office.
Boynton is 561-270-6494.
Yeah,
that's our Boynton office.
Yeah, you're good. So what it really says is if you're a patient of the AGI and you have a problem, your family member has a problem, or a friend has a problem, they're going to take care of it, which is just a whole new way to think about medicine, Dr. Mencia.
Absolutely. Suzanne, why don't we talk about the deep cleaning and superficial cleaning?
Yes.
What do they mean?
So a lot of patients don't understand that there's more than just one type of cleaning. So when they do come in, they're expecting something called a prophy, which is a very basic, simple cleaning for a very healthy mouth without any recession, bone loss, or inflammation. So for us to properly diagnose sometimes, we do a full mouth debridement, and we may reevaluate if they need further or not. If they need further, it's a deep cleaning, which usually involves maybe 3 visits. Okay, we have to get the right side numb, either with the gel or with the anesthetic, and you come back and we do the other side, and then we do a follow-up. And at that time, we put in an antibiotic called Atrodox, which is a tetracycline antibiotic, which works really well. And we also irrigate the gum tissue with a chlorhexidine rinse, just to help hinder that bacteria from out of those clean pockets. And the goal, obviously, is to reduce the pockets, stop further gum disease, and have the patient come on a recall 3-4 months time frame. It all depends on each individual patient.
And a lot of insurance, they cover that kind of cleaning at 100%.
Yes.
And if you don't have insurance, like I said before, we have great payment options in the office, and you could pay as little as $25 to $50 a month.
Sounds to me like if someone comes in and they need help and they see you, they're not leaving without the help.
No. And if you don't use your insurance, you lose your insurance.
She'll pay for it out of her own pocket. I can just hear this.
We've done pro bono work before. We really care.
Yeah,
I've seen Dr. Rosemary go, you know what, I'm going to do 3 extra crowns on the patient. I go, okay, so I go in and collect. Don't collect anything, Doreen. I'm doing it free. I want to help the patient. I'm like, wow, I've never seen that. I've never seen that.
Yes.
We have patients that come to the office and they have insurance, but sometimes they're insured. They just want to get their free prophy, like Suzanne was saying. And we always like to tell our patients what type of cleaning they need, but a lot of patients when we tell them they need like a perio cleaning, they don't want to do it. They just want their simple cleaning, their free cleanings. But we have to we have to tell the patient that they need the perio maintenance cleaning, and it's very important. And if they don't do this, what happens is patients grow a lot of plaque and tartar underneath their gums. And, if they don't do the perio cleanings, this will go on the bones. They'll start eating up on the bones, and patients will start getting bone loss and losing their teeth. And, that's what we try to prevent the patients from not losing their teeth, and they don't understand that.
And we had a patient in Boynton Beach come the other day, and she's a new patient to us, and she was going every 6 months to another dentist and having a prophy, and she came to us, and she has perio disease.
She says,
she has 5 and 6 millimeter
said,
pockets.
I'm a bleeder, and thinking in her mind that that's normal. And I explained to her, but that is unhealthy. Your gums should not bleed. Healthy gums won't bleed if I clean your teeth and they're plaque free.
And you keep them clean.
So I show her with the mirror, and I show her where's the bleeding coming from. It could be interproximal, in between, or is it the brushing or the flossing area, or both. And a lot of times they're really awed at the explanation visually. And I will show them the black calculus, which means it's been there for years, and they feel the difference,
Good for you.
Overall,
well, that's
and they really turn out to be very happy that they had no idea of the situation with their gums.
Yeah, that's a wonderful point, and I'm glad that you take the time. That's what I'm hearing.
And that's why it's our goal to communicate with the patients and let them know exactly what they need for their mouth, their oral health, and it's also bad for their health, their heart, and stuff like this to have all this bacteria in their mouth. And if they don't proceed with their perio cleanings that they need, they will lose their teeth later on in the future because it's going to continue getting worse.
You know, it's interesting that the vets, and we were just about having to close with the veterinarians, keep wanting to have your dogs come there so they can clean their teeth. Right?
It's important also.
Big. Yes. Yeah, very big. Thank you very much. Well, Dr. Mencia,